22,000 healthcare workers in Ontario suffer needle stick and sharps injuries every year. Nurses suffer 58% of those injuries. At least 33 blood-borne diseases can be contracted, including hepatitis B, hepatitis C, and HIV. The Ontario Nurses Association and its members have been campaigning for safer devices for 5 years. Ontario hospitals were not prepared for the SARS outbreak of 2003. ONA called for protection from the start, but hospitals did not respond adequately. Scores of nurses were exposed and infected. Many became terribly ill. 2 of our nurses died. Since 2003, ONA has pushed for all hospitals to use nothing less than the N95 mask to stop infectious disease. In August of this year, the hard work of ONA members and leaders paid off. Just before the Ontario election, Queen's Park passed a regulation requiring hospitals to replace hollow bore needles and needleless systems with safety-engineered devices. The Ontario government also announced that it will purchase and stockpile 55 million N95 masks in preparation for pandemic outbreaks.
The impact for safety-engineered needles and N95s for us on the front lines is a major improvement for us as far as safety. We now know that we are not going to have needleless needle sticks, and we also know that we are going to be protected when the next pandemic influenza comes along regarding having N95 respirators available for us. So this is an amazing success for us in ONA.
Justice Archie Campbell, in his final report on SARS, recommended that a precautionary principle be employed regarding the N95 mask. In its August announcement, the Ontario government embraced the precautionary principle, which means that hospitals will err on the side of caution in deciding to use the N95. 5 years ago, ONA formed a coalition with SEIU and OPSU to push the government into action on needle stick injuries for healthcare workers. Chuck Rackless is a lobbyist hired to assist the coalition.
ONA's been a partner from day one. All of these strategic decisions were taken with ONA. ONA staff helped in the development of our communications materials and our research papers, and every meeting that we had with representatives of the Ontario government occurred with somebody from ONA. In addition to that, the leadership of the union played a political role in speaking with the Minister of Health on countless occasions.
Well, the Safe Needles, our campaign actually started way back in 2002. So we have consistently been putting forward this message to the government. It actually had 2 bills go before Parliament on it, and those 2 bills did not pass. The good news is that with the ally support that we had, working with the coalition, with our rallies that we've had, with the grassroots members being that voice and speaking to the government and the employers, and frankly, with the strategic discussions that take place really behind closed doors as your provincial president with the decision makers, we made it happen before this legislature closed.
The Safe Needles Coalition launched an advertising campaign in 2005, which included billboards, newspaper ads, subway posters, postcards, and a radio spot.
Everyday Ontarians understand what nurses do in the healthcare system and value the work that they do. So when they heard about solutions that were available for pennies that could save lives and eliminate the risk of injury and illness, there was a lot of pressure generated in the broader community. The second thing was that because the union was involved from the leadership level down to the workplace activists to the rank and file members, we knew that every time we spoke to a government representative, we had the full weight of the ONA membership behind our case.
When we are going to actually succeed like we have in these 2 campaigns, all the building blocks are there, everything that we've already done. But the relationship that we as ONA, myself as president, have built up with the key decision makers is really, at the end of the day, where it's going to be at, because they are then going to listen after the many years of building that relationship and them knowing that we are the respected voice of the front lines. So they know when they get the call, and I can't talk about all the backroom politics that take place in moving our issues forward, but at the end of the day, they know when they get the call that this is a major issue for us in ONA and they need to act.
The next step will be to try to make the regulation all that it can be. As it's currently written, there are 2 classes of medical device that are excluded. There are scalpels and suture needles. And many, many injuries occur as a result of those devices, either directly to the person using them or indirectly to the housekeeping staff, laundry workers, and so on. Very small changes to the regulation would eliminate those categories as well. It was a terrific campaign to be involved with. People were in it because it was the right thing to do. We knew that any success that we got would eliminate injuries and save lives, and so that kept everybody going. So in that respect, the win is a pretty sweet achievement.